Hey everyone, I'm Jonathan Porter. I'm a partner in Husch Blackwell's Healthcare, Life Sciences, and Education Group. Thanks for joining our program today on AI integrations as a source of DOJ enforcement risk for academic medical centers. Excited that you've decided to join us today. Before we begin, I need to cover a few housekeeping items for you. At the bottom of your portal on your screen today, you can see that there are a lot of application icons that you can use during the webinar. One of those is the questions icon. If you have any questions during this webinar, you can submit those through that question box. I'm probably going to hold questions until the end, but I'm going to try to leave some time for questions at the end. However, if this gets full, if I end up talking the entire hour, which lawyers are prone to do, I'm going to reach out to you afterwards to make sure I get your question answered. But please do utilize that as we go. I can see it on my screen, and I'll do my best to get your questions. You could also see on your portal today, you can see a PDF of the presentation. If you want to save it and refer to it later, that's perfectly fine. So you can download that there. I'll also, as a reminder, this program has been approved for legal education hours. And if you want to report your hours, you can click on the CEU icon at the bottom of your screen. We'll also email you tomorrow with a certificate of your attendance, and it'll include the course number. Tomorrow we'll also send you a recording of the webcast so that you can watch it again over and over throughout the week and everything if you really want to do that. But you can also share it that way as well. So you'll get an email tomorrow with your CLE or CEU, whatever you want to call it, report, and a recording of this webcast. Toward the end of this program, I'm going to ask you to complete a short survey. We use your feedback to plan future programs, and we want these to be helpful to you and your organization. So if you could fill out that survey at the end, it'd be greatly appreciated. We would love to see your thoughts on this program so we can give you good stuff going forward. So that's all for housekeeping items right now, and we're going to get started with our program. So as a starting point, I want to show everyone this quote from this year's JP Morgan Healthcare Conference. I think this quote on the screen right now is a great starting point. Medical instruments are never going to be the same again. AI in healthcare, it's got just absolutely incredible promises. For those of us who view our careers in healthcare as a calling to help patients, to make patients' lives better, healthcare is done, then you've got to view AI as nothing but the biggest breakthroughs in healthcare over the millennia. You've got vaccines, anesthesia, medical imaging, antibiotics. When you think about it, AI could rank among those in terms of a difference maker to patients. There is quite simply a tremendous promise for AI in healthcare, and we'll talk a little bit about that in a second. But this is our starting point, is that AI is tremendously impressive in terms of potential, and something that hopefully you all are thinking about as you're steering your health systems. By the way, NVIDIA's stock has more than doubled since their CEO said this in January. So did Jensen's attention to healthcare cause NVIDIA's stock surge? Who's to say? No, probably not. But hey, it's great when amazing tech advancements also benefit healthcare and patients and everything. So we're obviously happy about. But here's the counterpoint. Here's the counterpoint to NVIDIA's, bull market view of AI in healthcare. Here's the bear market. Here's the counterpoint. The fact of the matter is that AI can be used to make heinous crimes even more heinous. That's what Deputy Attorney General Lisa Monaco was saying back in March of this year, is that AI has amazing potential to be weaponized. I've heard some very specific concerns in other sectors, not in healthcare, in the last couple of years when it comes to AI. But I can imagine some weaponization of AI in healthcare as well. and that's a serious thing to think about. But here's the rub when it comes to healthcare. While there are egregious frauds occurring in healthcare, a lot of enforcement in healthcare deals in shades of gray. The big question is whether federal enforcers are going to seek to lay the hammer to healthcare providers who embrace AI and then get into gray areas. These are the types of gray areas that have resulted in contentious healthcare enforcement litigation in recent years. So what will happen there? And are there areas that seem ripe for DOJ's hammer when it comes to AI in healthcare? That's the question that I want to answer today. But first, I'll introduce myself so you know who is talking to you through this very cool portal that Husch Blackwell has provided. So my name is Jonathan Porter. I'm a partner in Husch Blackwell's healthcare and white collar groups. I help healthcare providers, including academic medical centers, with federal investigations, internal investigations, and complex compliance issues. Before joining Husch Blackwell, I was a federal prosecutor in Georgia. And at the Justice Department, I handled white collar cases, with most of those being in the healthcare arena. I had some success as a federal prosecutor. I was involved in some of the large healthcare fraud takedowns, the ones involving billion-dollar orthotic brace and genetic testing schemes. I ended up training healthcare fraud prosecutors across the country and trained a bunch of HHS OIG federal agents too, all focused on emerging threats to the healthcare industry and how federal enforcers should identify, investigate, and prosecute those emerging threats. So this topic is in my wheelhouse. I was part of a panel that looked at many of these enforcement issues at the American Health Law Association's first AI in Healthcare conference. And in preparing for that, my co-panelists and I, we came up with dozens of enforcement area risks, but we wanted to explore a few in detail rather than just list a bunch of scary things. And so we narrowed the list to 6 primary areas of concern. We had an hour to present. We got through 2 of the 6 because there were so many questions. These are really fascinating topics. There's a lot to explore here. So what I've done is to tailor those issues down to what I think could impact academic medical centers in particular. And so I hope you get a lot from this webinar. And with that, of AI in healthcare, because the decision of the extent to which you should be focusing on integrating AI in healthcare, it involves a discussion of benefits and risk. Enforcement risk is our primary focus today, but frankly, a recent big picture enforcement trend in the past few years is that you see the Justice Department and its federal law enforcement colleagues responding to bad press and opening investigations into companies with bad press. I'm thinking about Theranos. I'm thinking about FTX. Those were companies and then ultimately prosecutions that didn't start. These were instances that got in the news first, and then the federal investigations followed. You know, Theranos was an example of bending a lot of representations, and then a very diligent Wall Street Journal reporter following it up, and then the prosecution came after. So it started with bad press, and then prosecution followed. Same with FTX. FTX was not something that DOJ, initially came to learn on the front end. They were as it was a reactive investigation. And so the fact of the matter is that a big public snafu involving AI in healthcare is the biggest enforcement risk right now. And so we're going to start big picture, and then we're going to zoom into some specifics. But before I get into a ton of risk areas, I want to make sure that we understand what the case for AI is in healthcare. The case for AI in healthcare is extremely promising. Faster and more accurate diagnoses. A lot of people who have studied this, who have studied AI in healthcare, have said that AI is just going to be better at processing data and driving diagnoses and courses of treatment than doctors are capable of. The average doctor spends just a couple of minutes before walking into a patient's room looking at charts and histories, tests, lab results, everything like that. the promise of AI, one of the best promises of AI right now, is that it can process all of the data. If you have integrated AI with your EHR, EMR, whatever you want to call it, it can process everything and do a better job faster of synthesizing everything into believed diagnoses, and it can drive the practice of medicine in really exciting ways, suggesting next steps, additional tests. Talking about differential diagnoses, this is a potential game changer. And so superhuman analysis in order to drive detection is great. Early detection is also something that AI is really, really promising at. It's identifying subtle patterns in data that can indicate disease in ways that brilliant humans have not been able to do to date. And so thinking about early detection of diseases, years down the road, you're going to see a lot of, if AI pans out the way a lot of people think AI will pan out, you're going to get a lot of saved lives just because AI is able to detect things earlier and earlier. It's also going to be great for personalized treatment plans. There are a lot of intricacies with patients that AI is going to be able to take into account and come up with treatment plans that maybe, in those few minutes before an MD walks into a patient's room, they're not really capturing, okay, there's this one thing deep buried in the medical records that could change the way I want to treat this patient. AI could catch that. AI is not going to be limited to a few minutes of medical review. And so there's a lot of potential for personalized treatment plans. Drug discovery is also, that's a big one that I hear from my friends in the life sciences industries. It's going to be able to do a lot of things as well. Access to care is also another big one. I've heard a lot of people talk about there are specific areas where access to care is a big problem. Rural healthcare is one of them. Behavioral health is another one, where you have patients who need access to someone to talk to at not necessarily 9 to 5 hours. And so behavioral health is tremendous. I've heard of a lot of people talk about how chatbots in healthcare could have tremendous potential as well. You can use that to answer basic medical questions, to schedule appointments, and talk about things that some patients have a hard time getting answers from their doctor. But these are ways and you've got so many wearables now. Access to healthcare, when it comes to wearables, you can get alerts very quickly in ways that you can't from your doctor right now. And so that's extremely exciting. And enhanced patient experience. The early tests, there was a study a couple of years ago that tested some of the early healthcare AI, like chatbots, against MDs, and found that AI has better patient bedside manner than MDs, which I think is fascinating. AI is able to understand how to communicate with patients. Sometimes MDs aren't the best at communicating with patients, very, very bright, but not able to synthesize things down in ways that are understandable to patients. And so when you talk about patient experience, AI has a lot of very impressive capabilities there. And when you're talking about a lot of underserved areas, people who may not be totally trusting of healthcare, this has a lot of potential to get patients feeling like they're being heard. And so that's really, really exciting. And so the promises for healthcare when it comes to AI is amazing. By the way, this slide that you're looking at right now, 100% generated by AI. I asked, I think it was ChatGPT, make the case for me of why healthcare, of why AI in healthcare is an amazing thing. And it generated this slide. This is the only slide that AI generated, but I thought it was funny that it did because this is about what I would have written without it. But so AI is smart and good and doing amazing things, including creating this slide for us. This is all very, very good things that we should be aware of. And after all, why wouldn't you want to do everything that you can in order to get these benefits for your patients? After all, Taco Bell is expanding AI use. Surely our nation's academic medical centers are savvier with advanced technologies than Taco Bell, right? What Taco Bell is doing is realizing that it can hear patient orders or patients, hear customer orders and document it, ring it up better than humans. And so Taco Bell is embracing AI. And so the question for you is, are you more advanced than Taco Bell? But of course, this is the same way. Nothing is as clear cut when it comes to AI as we like to think it is. The story isn't as clean when it comes to what AI is capable of doing. There's on your screen now, you can see that McDonald's abandoned its AI drive-through test 2 months ago when it just couldn't. It was making way too many mistakes, and customers were getting frustrated with it. 260 chicken McNuggets is a large chicken McNugget order. There's also something that went viral on TikTok this summer. I'm not on TikTok, but I found it in prepping for this. That talked about how someone wanted a sweet tea, and it kept ordering them 9 sweet teas. So there are struggles that people are dealing with when it comes to AI. And it's just interesting to hear how that you have this wide variety of experiences that people have. You have a lot of people who are having amazing experiences with AI, and you have some others that are just having really bad experiences. And so before we're sort of launching into integrating AI into healthcare, you've got to be aware that there are a lot of really bad experiences out there. And how badly do you want to be on the cutting edge of this when so many are having a hard time? There was a fascinating story. There was a podcast from AHLA just ended. It's the lighter side of health law, and it went into this story about Air Canada that's on your screen right now. So Air Canada had a chat bot that was designed to chat with patients. And I did it again. Customers, the life of a health lawyer. Air Canada had a chat bot that was chatting with its customers, and one of the customers went on the chat bot and said, "Hey, I have a bereavement situation of a family member died. I understand you have bereavement fares. So how do I go about obtaining a bereavement fare in order to travel, home for this funeral?" And the chatbot said, "We'll just go ahead and book a ticket at full price, and we will, on the back end, we will reimburse you for the cost of that, because this is bereavement fare, and that's our policy, is that we'll make this right for you." So the customer buys the full fare ticket and submits his invoice after the funeral. And whoever receives the invoice says, "What are you talking about? That's not our policy. That you didn't do it the right way." And so litigation ensued, and ultimately Air Canada was held liable for what its chatbot told the customer. This is how in the world a chatbot just made up a bereavement policy is the big question. I don't think that that's a situation that a lot of you want to be in. Not just billing stuff, but imagine the other things where if a patient of yours starts asking questions, is AI going to just make up answers like Air Canada's chatbot did? Is it going to just create policy that you don't like? And so there's a lot now. If Air Canada's chatbot is making up bereavement policies, what else could other AI systems do? And that's the really concerning thing. And then there was this goofy story last year where what people have started doing is to go into chatbots and see if they can convince it to do silly stuff, and then they put it on the internet. This was a chain of car dealerships in, I think, North Carolina. And funny people on the internet have sort of went on this chatbot system through the car dealership and started talking with it. And the way these interactions go is you can almost convince AI to make things happen. And what happened here was they started convincing the car dealership, well, isn't it your policy to make your customers happy? Yes. Isn't it really good when customers enjoy, happiness of the car? And it kept going, going, going. And it ultimately led to someone saying, what would make me really happy, given all of that, is if you sold me this model for $1, and I'd like for you to accept that now. It'll make me very happy. And he said, great. And the chatbot says, great. I will offer you this Chevy for $1. This is absurd. I'm pretty sure the person who was doing it wasn't actually trying to, get a Chevy for $1, just trying to put stuff online in order to make a sort of silly internet funny joke. And so this is the situation that we're in, is that there are people who are going online and going to chatbots and trying to make some funny points in order to do this. But think of the application in healthcare. The application in healthcare is sort of scary when it comes to stuff like this, because we don't know exactly what's going on. And so think about patient-facing care. This is a tremendous source of not just bad press, but also enforcement risk. So like I said a few minutes ago, bad press can be like waving a big flag for DOJ and HHS-OIG saying, hey, look at me. I'm doing this thing really, really wrong. Who knows what else I'm doing wrong? And so one of the best things about the promise of AI in healthcare is patient-facing care. Like I said, behavioral health, immediate access, but absolutely no one wants to make headlines in the way that Air Canada did. There's a range of disasters out there when it comes to bad, chatbots. Advising patients incorrectly, that's a really, really, really bad result. Think about drug interactions, for example. If you tell a chatbot, I'm on these medications, is it safe to take this one over here? And what if your AI program isn't trained to answer that question? That's not something that's sort of within their scope. How do you get it to say, call our office and ask an MD? Some people have tried that when it comes to AI. And for all the Air Canadas out there, they say that we've told it not to make up policies, but sometimes it just does. It feels like it's close enough where to make up a policy. What if it gets a drug interaction wrong? That would be really, really bad if a patient was harmed because it's not sort of trained, AI is not trained properly. But there are worse disasters too. If a chatbot can be talked into selling a car for $1, what could your chatbot be talked into? There are a lot of people on the internet trying to achieve absurd results. The mind goes to a lot of really bad places. Imagine the bad press that your health system could have if talked into various things. Think about some of the medical advice that some people could get that would sound ridiculous, but AI could do that. If it's selling a car for $1, who knows what sort of healthcare help it could give people who are trying to mess with the system. And so, we're at a spot where those things could be really, really bad and very embarrassing for your organization. So that's something that everyone should be aware of, because that's going to lead to not just embarrassment, but also potential enforcement risk as well. In addition, we're not at a spot in society where we're going to be very tolerant of AI making mistakes. When we think about human MDs, I think we're very accepting of the fact that some mistakes are going to happen. We're okay with human imperfection to a certain extent. But think about that when it comes to AI. Are we okay with AI imperfection? I think the answer to that is no. I don't think we are. I think we are going to look at people who roll out AI systems and we're going to hold it against them. We're going to look at Air Canada and say, well, I don't know how it happened, but you should have avoided that. You should have avoided a situation where your chatbot told a patient or told a customer that they can go get a full freight cost for a ticket, and then and then claim it on the back end for bereavement. Those things are going to be held against you. We're not okay. I think the same way, we're just not at a stage where we're going to be very forgiving of AI imperfection. I think prosecutors, judges, and juries are not going to be all that understanding of imperfection when it comes out of this, and all of that leads to general enforcement risk. And so, with all of that being said, let's talk about some specific areas of enforcement risk. And I've got them laid out. We're going to go through them. Let me note before I start digging into substance here. I've got these in an order that makes sense to talk about and that flows a little bit from concept to concept. These aren't in an order of risk magnitude or anything like that. And so don't take this as, this risk number one that's on your screen now is going to be the biggest one, and they flow down from there. Some of the later ones are in a way bigger, but I've got these just sort of organized in a way that I think will help us talk about these and understand these. So don't take order as anything other than just narrative convenience to me. But we're starting with a basic concept, and that's letting AI generate orders and referrals. So our starting point here is a settlement from 2021 with the University of Miami. It was a False Claims Act settlement. And what was going on with the University of Miami, they realized that, hey, every time we have kidney transplants come in, we want to run particular tests. Every doctor has agreed that in order to do these kidney transplants, we need these tests run every single time, no matter what the patient presents with. And so we're going to run this preset protocol of tests for every kidney transplant patient that comes in. We're not going to have an MD look at it. We're just going to run the test as soon as they come in, because we know that every physician wants this test done. A whistleblower files a qui tam. That qui tam alleges this and several other things. And one of the things that led to this large University of Miami False Claims Act settlement was the fact that tests were being ordered without an MD actually submitting an order. This was essentially like a preset protocol, and that doesn't typically meet a lot of CMS regs that say that you need a doctor to order something and certify medical necessity in so ordering. This is a good baseline because it shows that there are a lot of claims where you need doctors to be actively involved in order for those claims to be eligible for payment for Medicare. A doctor's got to see the patient and determine medical necessity before that test can be run. So when we're thinking about AI, this was a rudimentary. This was not a AI saying, let's go ahead and do this. This was more of a preset protocols. But the application to AI is pretty straightforward here. If you're using AI to automate processes in sort of isolated low-risk areas, that may make a lot of sense from a treatment standpoint. If you can take essentially what the University of Miami was doing and saying, here are instances where we always run this test. AI, why don't you find those instances, make it easy on the physician, take a load off of him or her, and just go ahead and figure out what we can automate. But just be aware that there are a lot of areas where if you're doing that, you could be violating CMS rules that say you've got to have a physician determine medical necessity before ordering the test. So do your homework when it comes to those CMS rules. Not every claim is like that. You've got to have medical necessity, but there are some specific ones that say you need an MD to put his or her eyes on the patient and determine medical necessity before it's submitted. And so just be aware that this is a sort of a simple application of AI to this space. If you've got someone, if you want to try to think about improving efficiencies, you've got to be aware of stuff like this, where there are bright line rules. Now, I think there was an argument here in this case that I'm sure defense counsel made, and that is that the MDs they approved of orders when they approved the protocol, that it's sort of this is a way to get doctors to sort of think about this situation on the front end. But I ultimately, they didn't feel strongly enough about that argument to take this any farther, and they resolved it via settlement. And so this is just one of those things. At some point, it's going to take CMS thinking about this. It's going to take the industry going to CMS and saying, hey, we've got all of these situations where we have efficiencies that would be great for us to do. I think if a physician were to explain to CMS, we've got to do this test every time we do a kidney transplant, they would say, yeah, that makes a lot of sense, and update the regs in order to make those types of things okay. Because I do think that CMS is pro healthcare innovating and thinking about how things work. It's just there's a lot of regs out there and they don't know what they don't know. And so it's going to take conversations between the industry and CMS for CMS to sort of update a lot of things like this. And so that leads to our next risk area. This is an interrelated concept of AI as a claims maximizer. So what does this mean? So AI, as we're thinking about AI as a system that can improve patient results, that can go through and look at all of the patients' charts and tests and histories and scans and everything, and lump it all together and spit out this potential for course of treatment. What other tests do we need to run in order to make a better diagnosis? Thinking about all of those things, that is AI being programmed for patient benefit. That's AI being programmed to say, here's how we diagnose, here's how we treat, and generating a lot of suggestions that MDs can learn from and appreciate and sort of used as a part of a course of action. In that same way, AI could be programmed a little bit differently. AI could also be programmed to say, look, while we're looking for what's best for patients, while we're looking for all of these things that could drive diagnosis and treatment, here's a list of things that we own. Here's a list of here's what Medicare pays and commercial payers pay for all of these things. And so AI, while you're thinking about what's good for patients, why don't you also think about, the financial side of healthcare? Why don't you also think that, hey, we've got this, this MRI that's being underutilized and it's got some capability, some capacity. What if patients were more likely to be referred to stuff like that when there was capacity? What if AI could incorporate all of that stuff? And what if you could do that with just some additional minor programming? I promise you there are a lot of people who are thinking about that right now in the healthcare space. Is how do we do what's best for patients, but also do well ourselves? Why can't we tell AI to factor in the business realities of healthcare while we're doing this? There's a lot of people thinking about that. What happens when that happens? At what point is CMS or the more federal enforcers going to say, well, hold on a second, this is now a problem? And so, just as easily as you can program AI to care for patients, I think you can program it to maximize profits. And so, how does this play out in a settlement conference, say with DOJ or a qui tam relator? It's largely a medical necessity argument. I think you could look at how often X was done, pre-AI, and then you can look at how often X was done post-AI. And the answer there is why did it change? It's because AI told MDs or suggested to MDs that this should be done, but they weren't doing it without the prompting. I think this plays out with extra tests, extra referrals, upcoding. Upcoding, I think, is really interesting. We're going to talk about that in a later risk area in terms of documentation. But upcoding is largely a concept that is tested by documentation. If you want a higher level of complexity, what if AI could take level 3 E&Ms and turn them into level 5s by augmenting the analysis, showing that the doctor is thinking about things that he or she might have thought about, maybe didn't think about. But if AI could be programmed to turn level 3s into level 5s just by augmenting the analysis, what happens there? Is that a false claim? I think I think DOJ would say yes. If the physician isn't actually thinking about these medical complexities, why should he or she get credit for them just because they're on a piece of paper? But how do you prove that they didn't think about those things? These are all really, really interesting issues, I think, that are coming because there's a lot of potential here. But AI as a claims maximizer is really, really big, because I do think I've heard from people in the healthcare industry that that capacity for MRIs or labs or whatever is going to be largely programmed to whatever AI system that they're designing, because you want to get high priority things in first, and AI can help sort of manage workflow. And the same with pharmacies and within hospitals, as you can use those things to sort of prioritize things. But it's interesting. If you can do those things, you could also sort of program it to say, hey, look, here are things that we get reimbursed for a lot. And just be aware that we have business interests. We can't run this hospital if we're not making ends meet. And so AI, while you're doing all of these things, why don't you also think about our business interests? And I think that's going to be really, really interesting. And that's going to drive a lot of really interesting cases, is when, because to me, this isn't even health systems that are programming AI saying, hey, just turn us into a revenue machine. What if you just programmed AI to say, look, just be aware of our business interests, and just if it's a shade of gray situation, do we need to order this extra test? If it's a profitable test, go ahead and do it. What if it's something like that? Those are all, to me, really, really interesting situations. I think you will see those once AI becomes more and more integrated into healthcare, because I think there will be healthcare providers who will do stuff like that. Really, really interesting stuff, to me at least. I'm a healthcare enforcement nerd though, so maybe I'm the only one. Risk area number 3. So fairness and bias is huge right now. I'm sure you all have heard about this risk, this enforcement risk. And it's really, really interesting. We could do another whole hour on just fairness and bias concerns. But you've got to know, I'm going to give you a very short version of it. This is very much on enforcers' radars. AI is largely a garbage in, garbage out design. And there's all sorts of concerns here. So historically, participants in clinical trials have been white. In a decade ago, someone just studied trials that were white. So really concerning. There's a potential to believe that white people should consume more than I've heard a lot of people say, that you look at some versus overrepresented in terms of healthcare consumption. Why that is, a lot of smart people have opined, but a lot of times it is that's leading to people who need healthcare more not getting healthcare. Could AI perpetuate that imbalance? Yes, the answer is absolutely yes. There's also been a lot of people who have done studies, and these are things that people have been trying to study for a while now. It's being exacerbated by the potential for AI in healthcare, because all of a sudden there's all these concerns that were not there earlier. There were still very concerning issues, but not in the let's ramp up a healthcare system that benefits from AI situation. So there have been studies into Black patients who receive painkillers. So there have been studies into the number of opioid prescriptions in the emergency departments. If you look at patients who come in with broken bones, Doctors prescribe 74% of white patients with broken bones, but only 57% of Black patients. Studies about the differences between men and women when it comes to diagnosing heart attacks. So doctors are 50% more likely to misdiagnose a heart attack if the patient is a woman. Black children as well. Black children with appendicitis are less likely to receive an opioid pain medication compared with white children. 12% of Black children are given opioid pain medication with appendicitis. 34% of white children are. So would AI process these stats and perpetuate these numbers? A lot of very smart people have said yes. AI learns from what has been done in the past. And so these are super, concerning statistics, especially when you realize that these statistics are going to drive decision making if and when we get to a spot where AI is going to be running healthcare more and more. And so it takes intentionality and effort to spot bias and to correct for it in AI. This is not something that AI is intuitively going to figure out on its own, at least not yet. Maybe at some point it will. But there's also questions in terms of the level of healthcare that is appropriate. So there was a Cal Berkeley researcher not long ago who dug into a large commercial payers pre-AI algorithm from like a decade back. And he analyzed the 50,000 medical records that had trained the algorithm and used the number of a patient's chronic conditions as the measure of their need. And on this metric, Black patients tended to have greater needs than white patients. But then he looked at the risk scores that the algorithm had assigned to patients, and the results were astounding. This researcher from Berkeley estimated that the algorithm's racial bias reduced the care of Black patients by over 50%. That's extremely, extremely troubling just on its own, but even more troubling when you think about the potential that has for AI going forward, if it's going to learn from that and treat patients based on that. There are a bunch of other studies who have sort of confirmed what the Berkeley researcher saw. Scientists at MIT discovered that computer vision algorithms used to diagnose pathologies based on chest x-rays worked just less well when it comes to Black patients. Extremely problematic there. Algorithms for detecting skin cancer were found to be less accurate on darker skinned patients. And in the UK, researchers discovered that data sets for training algorithms to diagnose eye diseases contained a disproportionate number of patient records from Europe and North America and China, meaning that they would likely perform worse for patients who are not from Europe or North America or China. So this is all super, I mean, again, we could spend a whole hour talking about this stuff, but what does this mean for enforcement? Here's the short version. I think if you fail to catch some AI perpetuation of these issues, I think federal enforcers are going to be waiting for you. What are the exact legal theories that you or whoever would be faced with? So the FTC has a lot of ability in this area. There was a settlement in December of 2023 where the FTC announced with a large pharmacy chain for that pharmacy chain's use of facial recognition technology in connection with its surveillance technologies for theft deterrence purposes. This was a groundbreaking settlement where the FTC took its first action against a company for algorithmic unfairness. What it was doing was giving the AI, attention. Look at all of these instances of theft. Now figure out how to stop theft going forward. And there was just algorithmic unfairness in there, targeting certain, race groups over others. And that was a big deal. And so this was a embarrassing settlement for the pharmacy chain. And so FTC is going to be looking at stuff like that. The legal side of it, and we have a lot of lawyers on, so I'll give you the legal side. Title 15 United States Code, Section 45. This is what FTC operates under. It allows FTC to take action against anyone who engages in, quote, unfair acts, quote, in commerce. Unfair acts is an extremely broad definition. That unfair acts is defined within the statute. without limitation. Without limitation, it talks about anything that's sort of unfair, results in harm to anyone. And so the FTC's got a lot of leeway to enforce here. So the big question is whether FTC. Sort of taking a little step aside for a second, FTC also has a lot of intra-agency enforcement mechanisms. Question is whether those are constitutional after the Jarczy case last month. That's interesting to me. Again, nerd right now, but I think this issue is so big that even if FTC wanted to avoid its own ALJ process, they'll just file stuff in federal court. When it comes to stuff like this, I think they'll just take stuff to federal court because they've heard from DOJ civil rights and HHS OCR that they want to find ways to enforce in this area as well. So this is going to be a really, really, really big deal, really interesting, really interesting stuff. So if you are going to wholesale integrate AI into your, way of doing things, you've got to be aware of issues of fairness and bias, because the federal enforcers right now are taking this really, really seriously. You've got to know about it and you've got to be aware of it. I don't think there's going to be a lot of forgiveness when it comes to ignorance on this. If you integrate and then there's something really, really bad that happens, you're not going to be able to say, "Oh, I had no idea," because there have been examples out there already. It's pretty well known in our industry that, and so you've got to be on top of it, or you don't need to be integrating AI. All right, so this is another one. I'm running a little bit short on time, and so I'm not going to spend as much time on data privacy and security breaches. I'm not a data privacy lawyer. I've looked at this from the HIPAA side, HIPAA like criminal HIPAA prosecution. I had some experience with that at DOJ, and so this is something that I find interesting. But I'm not a wholesale privacy lawyer, and so I'm going to skim on this section so we can talk about other stuff. But what you need to know is, in brief, the HIPAA concerns when it comes to using AI are huge, 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 huge. A lot of people I've heard who are smart on the privacy side have come to disagreement as to whether you're even allowed to do this, even if you have the right waivers. And so thinking about AI, the only way you can train AI is through large amounts of data. You've got to give it access to large amounts of data. And the question is, how do you de-identify it so much where AI, you can be assured that everything's going to be fine? And so even with the right waivers, I think there are still concerns with what AI does with massive amounts of PHI. That's an area, again, it's a really big area. I fear that you're going to hear in the next coming years, you're going to hear some horror stories of someone who gets hacked and uses AI to find a bunch of stuff, or AI sort of creates a vulnerability that wasn't there before. I think you're going to hear stuff like that, and that's going to be, again, that could be another hour that we spend, and hopefully people smarter than I are spending an hour talking about how data privacy is a big deal when it comes to AI. But that's talk about waving a big flag and telling federal enforcers that you need to be looked at. The data breaches is one of those. It's happening all the time in healthcare now. I'm very, very aware that it's happening all the time in healthcare. But I think using AI and a situation where AI makes your system more vulnerable will not be viewed favorably from federal enforcers. So that's that. All right, so this is a big one, AI as in the antitrust field. And this is mainly, to me, for academic medical centers with provider-sponsored health plans. This is a big deal. Anything involving health insurance right now is a big deal to DOJ. In fact, just last week, the Justice Department released details of a new whistleblower schemes involving health insurance plans. And so when two DOJ hot button issues, health insurance combined forces, you need to watch it. So this, and so before starting this, and I know a lot of you are at medical centers with provider-sponsored health plans. I know some of you are not. So if you're not, just pay a little bit of attention. This you might. There we go. All right. So what are we talking about? Meeting is noticed that you've suddenly started denying a lot of claims. I've heard from a lot of clients and others in the healthcare industry that the denials are coming in different cadence to them than before. And the answer for payers is the use of AI to make determinations on medical necessity in different ways than those payers did before. Aggregating payer-level data on patients, and it's making determinations on medical necessity for various claims. It's actually really, really interesting if you think about it. And it follows one of the interesting promises of AI that if we give it enough data, it can do things that humans just don't have time for when the stakes are low, as paying claims are, paying like individual level claims. And so payers, they don't have enough time or money to get a human to pour through claims data, diagnosis codes, et cetera, for a patient when a claim comes in. And then pour through other patients' data involving whatever is being claimed and combine all that analysis into decision-making, whether or not to approve or deny a claim. That's a lot of work, but AI can do that, and that's what's happening. And here's what's happening with some health insurance plans. And this is being reported in the media. I'm not, turning over anything that's attorney-client privilege or anything like this. I'm not revealing anything I'm not supposed to reveal here. But here's what's happening. A few large health insurance plans are only approving stays in skilled nursing facilities for a few days. This is just an example of the many antitrust concerns when it comes to AI. So health plans using AI to figure out how long to stay in. They were approving much longer stays, but now AI is telling them you should cut a lot of patients off from SNF stays. There are better, this is not medically necessary, the length of time that some are approving of these SNF stays. And so what's the rub here? Who benefits from shorter SNF stays? So the payer obviously does. The payer is paying less money to the SNFs because the patients are staying less longer. But think about that a little more. Who else is benefiting? One answer might be home health organizations could benefit. If you're not in a SNF, but you qualify for home health may benefit. And here's the tie-in with antitrust. A few of these large health plans just so happen to have invested billions of dollars acquiring strings of home health agencies. There's your antitrust concern. AI used to deny some claims that drive claims to a sector owned by the company making those payment decisions. There's your, I'm not a antitrust lawyer. I've dabbled a little bit when it comes to criminal antitrust cases, so I know this enough to know that that's a bit of a red flag to enforcers in the antitrust space. And so now's a good time. Now's a good time to think about how AI can be used in that way, and how you've got to have a heads up on what are some unintended consequences of AI decisions. And so you got to think, if my medical system sponsors some health plan, what are we doing? If we are denying some claims, are we going to, profit on the other end? So think about those. That's a really big deal right now. DOJ is very, very aware that that's an area of that is a big enforcement risk. And so just be aware of the antitrust concern there. All right, here's another one. I'm gonna fly through this one because we are running low on time. I've heard from friends in the healthcare industry, not clients, that a lot of health systems are now using AI to grade medical professionals. They are using AI and saying, if an AI, genius was our doctor, how would he or her have treated these patients? They've run these tests, done something else. And it's supposed to be for patient benefit. They're trying to have this as like a quality check. We were talking earlier, you could use those same things to talk about productivity, profitability. And so the question there is, what are the implications when it comes to using AI to grade our physicians? It's one thing to encourage doctors to make decisions based on AI. It's another thing to say, hey, we're going to grade you on something. And what if that grade actually influences how you're being compensated? I think there are some interesting, depending on how you do it, there's potential for False Claims Act risk there. If you're paying doctors to think the way that you want to think and follow the suggestions and the promptings of your system, that's a really interesting thing. And there's, AKS issues in there as well. I don't think that's that big of a deal on the AKS side unless you're really crossing a line, which we'll talk about now when it comes to AI clinical support and the anti-kickback statute. So the case to know here is Practice Fusion. This was an FCA case that was, and criminal case that happened a few years back. So think about clinical support, AI suggesting, hey, here's the potential for diagnosis. Why don't we run this test as well so that we can figure out if it's either of these two things? And so it will be used to guide decision making. There's already a lot of clinical support systems that are doing this on a sort of a low-tech basis. Practice Fusion, one of those. Practice Fusion ran into a problem where it was pinging physicians in their EHR with clinical decision support alerts. Now, clinical decision support alerts. Think about that. So you're practicing, and all of a sudden you get a ping saying, "Hey, why don't you think about this?" One of those pings, one of those alerts, was about opioids. So that would ping the doctors and say, "Hey, this patient is in pain. It's been a while. Why don't you prescribe opioids? Here's the AKS problem." Practice Fusion had a sponsorship deal, where particular opioid companies were paying them for these alerts. They had a sponsorship deal, and the opioid companies were able to offer input into how these pings worked. That Practice Fusion eventually agreed that was a violation of the anti-kickback statute. They were taking dollars to influence how they were pinging doctors, reminding them of things. So they ended up paying, I think it was $118 million False Claims Act settlement, $26 million in criminal fines and forfeiture. They ended up pleading guilty, the corporation did. So when you're integrating AI to assist in clinical support, you've got to think about, whether there are dollars behind this, whether there are dollars that impact this, and think about, are dollars flowing from someone benefiting from this in a way that's not, true to, accurate medical decision making. All right. I'm running long. I'm going to talk about it, just a couple more things, and then we're going to end this because you guys are busy and have things to get back to. So one of the cool things about ambient documentation right now, doctors hate documenting stuff. It's a leading source of burnout for doctors, and AI fixes that. But Medicare rules in general require documentation that shows medical necessity, and sometimes much more depending on what's happening. And so there's two real big issues in utilizing these ambient documentation models. First, AI could just get stuff wrong. Most of these platforms require doctors to spend time to actually review before they finalize it. But doctors don't spend a lot of time reviewing stuff. They're in a hurry, and they're going to click through, and they're going to say, "Yeah, it looks pretty good." So getting stuff wrong is risky. You got patient harm issues, you've got false statement issues, and I can see a lot of bad stuff coming from there. But second, AI could just get stuff right, but it also not meet the documentation levels that's expected by regulators. So I think a lot about cloned notes. If AI is just doing a better job of cloned notes, I think people are going to think badly about this. So, prosecutors, judges, juries, they hate cloned notes. And so if ambient documentation includes stuff in the records, but it's not part of the MB's actual decision making, I think that calls into question a lot of other things that are going on. Finally, most of what we're talking about is in that gray area, but look, there are people who are going out there trying to commit willful, healthcare fraud. I was involved in some of those large, telehealth operations when I was at DOJ. And those were largely driven by fake medical records. Fake medical records could get a lot better using AI. And so what I want you to do, for those who are at health systems, warn your doctors. Go to your doctor. If you do nothing else from this, go to your doctors at some point at your next meeting and say, "Look, there have been a lot of doctors who've gotten in trouble moonlighting, ordering things for patients they're not treating." Don't do that. AI could make those schemes a lot more effective at fooling, audits and stuff like that. And so don't you've got to alert your doctors that they cannot be ordering things for patients that they're not treating. That's the scheme, and those schemes are going to get so much better if willful healthcare fraudsters are going to implement those, and they will. Those schemes are going to get really good, really hard to detect, and so that's where we are. So I've run right through times for questions. I see questions in the chat. I'm going to follow up with you guys. But if you have more questions, email me. My email's on the slide right there. Happy to talk about any of this stuff. I also have a podcast. You can grab your phone and do this QR code that's on the screen right now. If you're interested in my podcast where we talk about all things about the False Claims Act, I'd love for you to take a listen. But that is the webinar. I want to thank you for joining me today. I hope the information was helpful to you. Here's your reminder at the back end. You've been approved for legal education hours. Click the CEU button at the bottom of your screen. We're going to send you a certificate of attendance with course numbers to you tomorrow via email. We'll also give you this recording so you can go back and watch it. I'd also love it if you would take a short survey. We're going to use that to plan future programs. And so seriously, take the survey. That would help us out a lot. But if you have any questions at all about this, I'm here. I love talking about this stuff. And so just reach out. Send me an email. I'd love to chat about any of this. Like I said, huge healthcare nerd, and so would love to talk to you about it. But thanks for attending, and this concludes our webinar. Thank you very much.